Good afternoon. My name is Tanya Andricks and I'm the CEO of Crossing Healthcare. And unfortunately, we're here today to share with the community some very disturbing trends that we are seeing in our community as it relates to COVID-19. I'm joined today by the leaders of the healthcare community, including the CEOs of both hospitals, Decatur Memorial and St. Mary's Hospital, as well as Brandy Binkley, our health department administrator. But first, I'm a registered nurse, and I've been a registered nurse in this community since 1995. I've served in so many capacities, from bedside care to leadership roles, alongside some of the most stellar healthcare professionals that I can imagine. And I've always served a community that has shown nothing but gratitude for the care that we've provided, and it's always been a privilege. Today we find ourselves in a really tough spot, and we're really going to have to share with you some information that's difficult. But before we do that, I have one request. My ask is for each of you to pause, take a deep breath, and listen without judgment to the information that's going to be shared with you. Please, for a few moments, set aside your opinions and listen to this information that both Teresa Rutherford and Drew Early and Brandy Binkley are going to share with you. Please give thought to what you can do to help. We are not here to talk about state and federal policy. We are here directly to talk to you about the limited healthcare resources available right now for each of us and our families. This is personal. This is home, and it is information that we all need to hear. Next, I'm going to turn this over to Drew Early from Decatur Memorial Hospital. He is the CEO of DMH.
Thank you, Tanya, and thank you all for being here. My name is Drew Early. I'm the President and CEO of Decatur Memorial Hospital. A little over 2 months ago, we stood in this very room and were reporting on positive trends of COVID-19 declining. And at that time, we urged the community to take the steps to keep those numbers there. Well, unfortunately, and it is not something that I'm glad to be here to talk about, the numbers are going in the wrong direction. At the present time, Decatur Memorial Hospital is seeing as many COVID patients as we were last fall. Again, the numbers we're seeing, we have not seen since last fall. The stress on the system is tremendous. The stress on caregivers, our friends, our family, our neighbors, is tremendous. So we come here today to implore the community to take the necessary steps to slow the spread. Continue to wear your mask, wash your hands. More than anything, we implore the community to become vaccinated. Vaccine is available widely, it is free of charge, it is safe and is effective, and it is proven to be the one step that we can take to have the largest impact on depressing the numbers of COVID-19 in our community. Again, it is not something I wanted to come and speak to the community about, but we need to be honest with what we're seeing. And what we're seeing is incredibly concerning. And this is not just in Decatur. We're seeing similar stories in Springfield, Champaign, Peoria, Bloomington, as far away as St. Louis and Indianapolis. These numbers are moving in the right direction. And at the present time, only the community can inflect those numbers down. So with that, I'll introduce Teresa Rutherford from St. Mary's.
Thanks, Drew, and thanks to everyone for being here. I'm going to reiterate some of what you've already heard. Reality is, this is about us wanting to keep our community open, keep our businesses flowing, keep our children in school, and continue to progress throughout the year. Reality is, we are seeing increasing numbers. We want to have a healthy community, and that means that both Drew and I, and the teams that we are fortunate to lead, want to have our healthcare system able to do surgeries and other things that are needed each and every day. However, if we continue on the trend that we are and the climbing numbers, that will become questionable. So we do need each of you to continue to wear your mask, wash your hands, social distance, and talk with your provider about if you are or are not the appropriate person to get the vaccine. As Drew said, the vaccine is very, very safe. and we have seen great success with it. So please consider that. Consider it not only for the healthcare system, but for our community as a whole. We really want to keep Decatur alive and open, our businesses successful and moving forward. So now I'll let our health department give you some of the specifics.
Good afternoon, everyone. My name is Brandy Binkley. I'm the Public Health Administrator here at the Macon County Health Department. As you are hearing, there are definitely some concerning trends that have been happening and are getting more and more serious and scary each day and each week. At the Health Department, we are seeing more and more cases per day. This week we've had days of over 40, so we are certainly inching up in a way that we do not want to. And each of those cases then comes with contacts, sometimes lists of up to 50 people, that in some cases, if they are not vaccinated fully, then they would have to quarantine. All of our goal is for everyone to live healthy and to be safe. And one of the ways to move forward is to be vaccinated. And so we do encourage everyone that can be vaccinated to do so. As a reminder, there are some people that cannot be vaccinated, including children 11 and under. So we continue to encourage all of you to take those preventative measures that we've been asking you to take for such a long time now. And one of the things we do want you all to be aware of, if you are not yet, is that right now the CDC and IDPH is encouraging masking for everyone regardless of your vaccination status, because of the fact that we are in high transmission here in Macon County. That mask guidance goes for any communities in substantial or high transmission, and right now Macon County is in the highest category at this time. And unfortunately, we're not seeing a dip down in any way. As of the dates of August 5th to August 11th, the CDC COVID data tracker, which is the most recent data at this time, shows that we are in high transmission, and we have 254 cases per 100,000. And this was a change of an increase of 111.67% in the past 7 days. If you remember last fall, when things were incredibly scary, we were up in those 200s. At that time, we did not have the resource of a vaccine, and now that is one of those tools that we can use to save lives and protect ourselves and others. And our percent positivity is now at 8.5%. Testing volume has gone up 36.56%. So we know that this is in our community more, and people are getting tested more, and we do encourage you to do that. There are currently 260 variant cases, but as we put out to the community, not every single specimen is sequenced. So we do expect that there are probably more variant cases than that here in Macon County, and some are much more transmissible than other strains. So it's very important to be aware of that and take precautions. There are vaccination opportunities throughout our community. The health department is offering vaccines several days a week, both on appointment and walk-in basis, and I know many of our healthcare partners and pharmacies are doing the same. So there's plenty of accessibility here in the community if you're able to get vaccinated. Another thing that we wanted to let the community know is that we will be increasing the frequency of the reports that we are putting out data. We will now be doing those again Monday through Friday. The report will look a little bit different on Monday through Thursday. It will have your daily update, and then on that Friday of each week, you will see the full report with all demographics that you are used to seeing. That is a way that we are able to get that information out to you as quickly as possible and do it with the allowable staffing that we do have at this time. Another incredible change that has happened here recently is that the mask mandate did come out. It did affect long-term care and schools. So we are strongly encouraging, and we have been encouraging schools to follow that mask mandate and keep children and children and staff as healthy and safe as possible, and keep those children in school where they really need to be. So that's all I have, and I don't know if you want to come up for questions or with any closing remarks.
Sure. Again, I want to thank you for being here today, for getting this information out to the public. I want to thank every member of the leaders of our healthcare community, because right now things are very difficult, and they're leading stellar groups of professionals through a very difficult time. So thank you all. And at this time, I will entertain questions for the panel.
Teresa, you mentioned about, possibly if this continues to trend upward, you mentioned elective surgeries, and this comment could be a question also for Drew. Is that currently in danger?
At current time, it is not, but we are evaluating on a day-by-day basis because we want to assure that not only the patients already in our hospital, but that any that we would bring forward would have placement and the ability to have the full team and care that they need while they are there. As the COVID patients continue to climb in both of our facilities, we have to evaluate what that looks like. So at this point, our goal is to keep healthcare moving forward and to keep our ORs and patients being well cared for. But we do have to continue to think about it as we move forward.
Yeah, Decatur Memorial Hospital, as well as Memorial Health System, is currently evaluating elective surgeries on a day-by-day basis. At the present time, we have not had to defer any elective surgeries. However, that is something that we watch on a day-by-day basis based on the demands that are currently on the health system. Yes?
The CDC issued an eviction moratorium